Senate Republican leaders introduced their secret healthcare bill on June 22nd to a more or less meh reaction from their fellow Republican senators. That's a problem. Senate Republican leaders have 52 members. They need 50 of them to vote for this bill. Otherwise, it doesn't pass. And kind of like a game of Mario Kart, they have a ton of roadblocks to dodge while they're going really quickly. Four in particular that they really need to watch out for. Roadblock number one, the anti-Obamacare purists. These are conservative senators like Ted Cruz and Rand Paul and Mike Lee who say, if it's not repealing Obamacare, we don't want any part of it. And a couple hours after the bill was released, 4 senators basically said that. They said, as the bill is, we just can't vote for it. It's not what we promised to our constituents.
I don't think there's anybody in America that's more against Obamacare than myself. As a physician, I've seen the ravages of it. I've traveled to 42 states running on repeal of Obamacare.
Roadblock number 2, I call them Medicaid senators. These senators represent states mostly in the Midwest that expanded Medicaid under Obamacare and now are having a really hard time voting to cut off that Medicaid expansion without a safety net for a lot of their constituents. In this group, you have Senator Dean Heller, who is one of the most vulnerable senators in 2018 in running for re-election in a state in Nevada that expanded Medicaid. He's going to have a very difficult time if he votes for this bill, going home to tell his constituents, yep, I voted to end your health care that you got just a few years after you got it. Roadblock number 3, I call the wild card. These are state-specific issues that any senator could come up with and say, I have a problem and I can't vote for this bill because of it. It includes cutting off funding to Planned Parenthood and other nonprofit women's clinics. There are at least 2 senators who say they want to see funding in the bill.
It's not the only issue in this huge bill, but I certainly think that it's not fair and it is a mistake to defund Planned Parenthood.
It includes funding for opioid addiction, a crisis that's affecting a lot of senators, especially in the Midwest and in New England. Any number of things could crop up. And remember, all it takes is 3 senators to say, I can't vote for this bill, to kill it. Roadblock number 4, the numbers. Sometime in the next few days, we're expecting the nonpartisan Congressional Budget Office to release an estimate of how this bill affects the healthcare market and your health insurance. If those numbers are really, really high in terms of uninsured, it could derail the entire thing. We basically saw that happen this spring with the House bill. This is a really, really big hurdle to overcome because you have to have a nonpartisan report that calculates the effect of this healthcare bill in a way that you can go sell it to your constituents.